The Sustainable Development Goals (SDG) are a set of global objectives established by the United Nations to address the world's more pressing social, economic, and environmental challenges. These goals provide a roadmap for countries, organizations, and individuals to work together toward a more sustainable and equitable future. Our presentation focuses on SDG 3, which is good health and well-being. It aims to ensure healthy life and promote well-being for all people of all ages. SDG 3 is concerned with enhancing health outcomes, lowering mortality rates, and reducing the burden of diseases, and also tackling the major causes of death worldwide. The concept of SDG 3. The development of preventive healthcare and health promotion is one of the concepts under SDG 3 to promote healthy life and combat the main causes of mortality in Malaysia. Healthcare promotion and prevention is a broad strategy that emphasizes proactive action to improve health, prevent illness, and address the main causes of mortality within the context of SDG 3 in Malaysia. In order to improve population health outcomes and lower mortality rate requires a variety of initiatives, interventions, and regulations. Malaysia may provide priority to preventive healthcare by adopting the idea of healthcare promotion and prevention under SDG 3. This may result in better population health outcomes, lower death rate, and overall healthier society. The significance of the concept in sustainable development. The most significant thing of the concept is Malaysia can improve the development of its human capital by prioritizing preventive healthcare and health promotion. Preventive healthcare and health promotion can improve the population's overall health. People who are in good health can function at their highest level on a physical and mental level and increasing productivity. They can fully engage in economic activity, further studies, and pursue career opportunities that will boost economic growth. Second, a healthy population is more likely to engage in education and skill development activities. By preventive healthcare and health promotion, SDG 3 supports human capital development by enabling individuals to participate fully in educational programs, acquire new skills, and enhance their knowledge. This, in turn, leads to an increase in the overall human capital and supports sustainable economic growth in Malaysia. Next, lower mortality rates in Malaysia lead to healthier and longer working life, resulting in long-term economic benefits. By addressing the main causes of death, Malaysia can reduce healthcare costs and improve labour participation. This creates a healthier and more skilled workforce, contributing to economic resilience, increased investment, and give long-term economic growth. Overall, these factors contribute to the growth of Malaysia's human capital and development of a sustainable economy, thus preventing the primary cause of death and reducing mortality rates in Malaysia have a substantial impact on human capital in addition to saving life and enhancing public health.
Now, let's look at some targets of the third SDG that are related to mortality. Target 3.1 Maternal mortality, which continues to be a major concern in many regions of the world, is the subject of this target. Achieving this goal will require access to emergency obstetric care, competent birth attendance, and high quality reproductive health care. For women's health and well being, as well as the survival and growth of their infants, it is crucial to reduce maternal mortality. Target 3.2 In order to reduce the number of avoidable deaths among newborns and child under 5, this target addresses child mortality. It places a strong emphasis on the necessity of high quality healthcare for mothers and children, vaccines, nutrition intervention, and the prevention and treatment of serious pediatric disorder. In order to increase child survival rates and guarantee healthy growth, it is imperative to accomplish this goal. Target 3.3 This goal focuses on main communicable disease that significantly increase worldwide mortality rates. It seeks to eradicate diseases like HIV, AIDS, TB, malaria, and neglected tropical illnesses. It also emphasizes how crucial it is to fight communicable disease, including those that are waterborne. In order to accomplish this goal and lower the death rate related to this disease, effective prevention tactics, cheap treatment options, and strengthened healthcare system are essential. Target 3.4 Non-communicable disease, which include chronic respiratory condition, cancer, diabetes, and cardiovascular disease, are the main cause of death worldwide. This goal focuses on lowering NCD-related premature mortality through preventive tactics, early identification and treatment, and mental health promotion. It focuses on the importance of leading healthy life, having access to basic healthcare, and addressing risk factors like cigarette use, poor diet, and inactivity.
The first indicator is maternal mortality rate, and we aim to have less than 70 mortality rate for every 100,000 pregnant women. The main cause of this death is postpartum hemorrhage, which is a condition where a woman has a heavy bleeding after the childbirth. As we can see in the graph, in 2016 to 2019, the mortality rate declined continuously, which is a good sign as we are able to control that complication for keep occurring. But in 2020, the rate started to increase until it reached the highest value in the 2021. The cause of this significant rise is the bed vacancy and the health workers availability due to the pandemic COVID-19. Also, the pregnant women avoid coming to the medical institution as they are afraid they might get the COVID. Overall, we did achieve our aim, but the rate might increase again if the bed vacancy and the availability of the health workers problem are not being solved. As we aim to improve the recruitment and the development of health workforce, we can measure it through health worker density, which shows the ratio per population. We have one doctor for every 420 people, which is good, as WHO recommends country to have one doctor for every 500 population. And we have one nurse for every 283 people, which is also good because nurses interact and take care of the patients most of the time than the doctors do. The pharmacist ratio seems low, but it is not so worrying as they only involved in the medication and not for the whole treatment. But we surely need more dentists as oral hygiene is much as important as other treatment. Next, our goal is to halve the traffic death rate. And from the graph, generally we can see the death rate is decreasing as the maximum value is in 2000 and the minimum value is in 2021. And we did manage to halve our traffic death rate in 2021, but there is no guarantee that the traffic death rate onwards will be as low as in 2021. We need to remember that in 2021 is where the pandemic COVID-19 occurs and there is also the movement controls order. Therefore, we still need to monitor this traffic death rate before we can conclude that we already achieved our goal. Our last goal is to end epidemics and combat contagious disease. We can measure it through the monitoring diseases with highest incidence rate and mortality rate. In the brown circle, there is diseases with high mortality rate, and the gray circle, incidence rate. Hepatitis B, AIDS, and HIV is transmitted through body fluid, while COVID-19, tuberculosis, and HFMD is transmitted through airborne and touch. We can prevent hepatitis B and COVID-19 by receiving vaccination, while HFMD and TB need proper care of hygiene. Lastly, we can prevent AIDS and HIV by reducing the numbers of drug addicts and practicing safe, intimate intercourse.
There are various factors that influence good health and well-being, but what are the most crucial factors in maintaining optimal health? Studies have figured out the four most important factors that have the greatest impact on overall health and wellness. The four factors are diet, rest, exercise, and relationship. In Malaysia, heart disease is the leading cause of mortality. The most common heart disease in Malaysia is ischemic heart disease. We all know one of the reasons that cause heart disease is unhealthy behavior of eating. So, factor number one is nutritional diet for maintaining good health. What is nutritional diet? Nutritional diet is a food intake that is rich in nutrition and includes seven classes of food pyramid. What happens if we don't control our diet? If we don't control our diet, such as poor eating pattern, will lead to chronic disease, including cardiovascular disease, high blood pressure, type 2 diabetes, cancer, and poor bone health. What is benefit of taking nutritional diet? Benefit number one is preventing chronic disease, including cardiovascular disease. Benefit number two is support human growth. For example, children should consume a diet high in calcium, since this mineral is essential for the growth of strong bones and teeth, while in adulthood, calcium is needed to slow down bone loss such as osteoporosis. Factor number two is rest for enhanced wellness. What is rest? Rest may be hard to describe since it can mean various things to different people. We can simplify rest as any activity taken to improve a person physically and mentally. It might be an active activity like taking a walk outside or a passive one like taking 10 minutes to sit down and breathe deeply. Regardless of how your preference for rest, this regular habit can help you recover and recharge. What happens if we don't rest? Nowadays, rest frequently comes last on the list of priorities, especially during short and hectic day. The neglect of rest may cause long-term effects in the future, such as mental illness and chronic disease. What is benefit of rest? In Malaysia, a lot of people suffer from high blood pressure. So, one of way that we can do to reduce our blood pressure is by resting. And next, benefit of rest is chronic pain relief, improve human health, and build stronger cardiovascular system. Factor number three is exercise for maintaining good health. Exercise is a physical activity that improves or maintain our physical fitness and general health and well-being. What is the benefit of exercise? Benefit number one is it can prevent from chronic disease such as obesity. Exercise help prevent excessive weight gain and help maintain weight loss. Regular exercise can help prevent obesity and help those suffering from obesity to be normal again. This is because obesity results from energy imbalance, too many calories, and too few calories burned. Physical activity burns calorie. The more intense the activity, the more calorie can be burned. On the other hand, exercise also improves our mental health and our mood. Physical activity stimulates a variety of brain chemicals that may leave a happier feeling, more relaxed, and reduce anxiety. This can help us to deal with stress and reduce the risk of depression. Third, exercise leads to better quality of sleep. Regular physical activity help us to fall asleep faster and get a better and longer sleep. Furthermore, exercise can reduce the risk of heart disease. Exercise strengthens the heart and improves blood circulation. Increased blood circulation also increases the oxygen level in the body. This will help reduce the risk of heart disease such as high cholesterol, coronary artery disease, and heart attack. Last but not least, exercise help our body control blood sugar and insulin level. Exercise lower blood sugar level and increase the effectiveness of insulin. This can reduce the risk of metabolic syndrome and type 2 diabetes. However, we need to avoid exercising too close to bedtime as it can cause us to be too energized and keep us awake. Factor number four is happy relationship to boost well-being. Social support from relationship, including romantic and friendship relationship, contribute to well-being and quality of life. Social connection are very important part of being a human. The benefit of a good relationship are numerous. A happy relationship can reduce the incidence of anxiety and depression. A committed relationship lower the production of cortisol, a stress hormone. Emotional support that comes with having a partner can be a great buffer against stress. People who have close relationship with friends, family, or significant other are happier than those who don't. The happier people are, the more likely they are to have good relationship and receive support from others. Having positive interaction with other people make you feel better and happier. Conversely, broken or damaged social ties can have a huge impact on our mental health and well-being. A lack of close relationship and lack of sense of belonging can put physical and mental health at risk. From a health perspective, loneliness puts people at the same health risk as smoking and obesity. Loneliness increases the risk of heart disease, stroke, high blood pressure, cognitive decline, and sleep problems. Additionally, loneliness can increase the risk of depression and suicide. In fact, relationship conflicts are often closely related to depression. Difficulty in relationship create feeling of depression, and depression lead to social withdrawal.
Next, I will cover about government intervention. There are three about the government policies which are The first one, the Malaysian Ministry of Health regularly conducts the National Health and Morbidity Surveys, which are important sources of data on different health matters, including causes of death. These surveys collect comprehensive information from a representative sample of the population, including data on mortality rates and the main causes of death. By analyzing this data, policymakers gain valuable insight into the health trends. So the second one is the government of Malaysia has developed the National Strategic Plan for Non-Communicable Disease in response to the increasing burden of non-communicable disease on mortality rates. This plan provides a comprehensive strategy to prevent, control and manage NCDs, which encompass diseases like heart disease, cancer, diabetes and chronic respiratory disease. The NSP NCD adopts a multi-sectional approach incorporating health promotion campaigns, improve healthcare service, policy intervention, and strengthen surveillance and monitoring system by targeting risk factors such as tobacco use, unhealthy diet, physical inactivity, and alcohol consumption. The plan aims to decrease premature mortality caused by NCD and mitigate their impact on the population mortality rates. The health population boards plays a crucial role in implementing health promotion activities and campaigns in Malaysia. So the third one is Malaysia has introduced the National Cancer Control Policy, which is NCCP, to address the increasing burden of cancer and its impact on mortality rates. The NCCP focuses on a comprehensive approach to cancer control, covering prevention, early detection, treatment, and palliative care. The policy highlights the significance of public education campaigns to raise awareness about risk factors and symptoms, the implementation of cancer screening programs, ensuring affordable and high-quality cancer treatment, and strengthening the integration of palliative care service. There are three initiatives and programs which are the first one is the goal of talent grooming program is to strengthen the development of leadership skills and instill various qualities in aspiring technical healthcare professionals to enhance the performance of the healthcare system and promote better health outcomes for the population by fostering effective healthcare leadership. The talent grooming entails more than just developing technical skills and support. It also aims to cultivate a high performance, sustainable organization that aligns with the ministry's strategic goals and objectives. The second one is the Initiative of Salt Reduction Strategy to Prevent and Control NCD for Malaysia. This strategy focuses on reducing salt intake to combat cardiovascular disease. The objective is to promote collaboration and education among stakeholders to achieve a 30% reduction in the average salt intake of the Malaysian population by 2025. The strategy aims to modify population behavior and implements the MAP strategies, which are stand for Monitoring Awareness Product to strengthen existing intervention. Lastly, the National Strategic Plan for Cancer Control Program, which aim to reduce the negative impact of cancer by decreasing morbidity and mortality while improving the quality of life for cancer patients and their families. The NSPCCP takes a holistic approach to cancer care encompassing primary prevention, screening, early detection, diagnosis, treatment, rehabilitation, palliative care, traditional and complementary medicine and research. It emphasized the need for support and commitment from stakeholders, including public and private sectors agencies, cancer center professional bodies and NGOs. Collaboration and strengthening of existing networks are crucial to address the burden of cancer and management issues.